Virgin Islands, Ms. Plaskett, to inquire.
Thank you so much, Mr. Chairman, and thank you for this hearing. I think the witnesses have been absolutely incredible. I want to thank you for the staff for putting this together. This has been absolutely informative. I've been so grateful to members on both sides of the aisle who have really asked some tremendous questions and the information that we've been able to glean from this. You know, we focused on issues of substance abuse disorders, overdose death, and suicides, which are in fact a huge epidemic in this country. And taking a deep dive on these issues, looking at how the rates have increased exponentially over the last decade, and the work that's being done to try and stem the tide of something that seems to be just absolutely overwhelming. The need for greater awareness of how federal policies have long stigmatized and marginalized treatment for those in need, of course, people struggling with substance use disorders and suicide ideation into shadows. I'm so grateful for you, Mr. Chairman, and the other members of the committee for shining a light on this throughout the country and even within our own lives. You know, I have a couple of questions here. One of the things that I noted, however, and I don't mean to throw any cold water on the care and the concern that many of the members have expressed in this discussion, but there has been a stark, glaring absence in some of the discussion that I've been hearing. I know that one of my colleagues earlier in the discussion talked about the Support for Patients and Communities Act that was passed in 2018. He mentioned also the Comprehensive Addiction and Recovery Act of 2016. So much of this legislation is related and focused squarely on opioids, squarely on prescription drug addiction, which is absolutely necessary. It is something that is going out of control within this country. But I cannot not notice the fact that we have not given this same kind of discussion and the need to, the ability to call individuals who are addicted to prescription drugs as having a mental disease, and those who are addicted to crack cocaine or heroin in communities of color as being criminals and drug addicts. My colleagues across the aisle are unwilling to expand prescription drug and support for individuals who are addicted to crack cocaine, addicted to heroin, and the ravage that that is doing in those communities as well. I have had several cousins early in the beginning of the crack cocaine epidemic, early on during the AIDS epidemic, die of either crack cocaine or heroin addiction that precipitated them dying in the early 80s from AIDS. And so I wanted to ask these practitioners, what do you think has transpired over the last 30 years that is now allowing us to call prescription drugs addiction as a mental health addiction, a disease? And those individuals who are addicted to crack cocaine, heroin, and other drugs, which are predominantly in African American and people of color communities, as still as criminals.
Thank you for, this is Dr. Chapman. I'd like to answer that. In my presentation for the Office of Minority Health about 3 years ago, I emphasized the historical difference of Africans in America. We started with slavery. We went through the post-slavery era of Reconstruction, then the Jim Crow era with hangings and segregation. So I showed slides that showed that this is a continuum, and it really hasn't changed into the post-civil rights era. So our community has always suffered from post-traumatic stress disorder, and it's been intergenerational. It was just ignored.
Thank you. I have so little time. If anybody else wanted to offer any thoughts on this?
My research shows that that when you call something an addiction versus criminalize it, of course, it leads to different outcomes. And so an addiction leads to support networks, which are super important, whereas criminalization of something leads to the prison pipeline, basically, or things like that. So this has real real consequences. And so we really need to broaden the definition of addiction and also the alternatives to ways out of it for people.
So in closing, I would just ask that my colleagues across the aisle show the same empathy that they have for prescription drugs and opioids to the ravages that are occurring in my community from crack cocaine, heroin, and other drugs that you are insisting on criminalizing. I yield back and thank you so much, Mr. Chairman.
Thank
for
the
opportunity.
gentlelady. Let me